Hello and welcome to the first episode of A Cancer Conversation with the Georgia Cancer Center for 2022. Today we are going to be discussing cervical cancer. As you may know, January is Cervical Cancer Awareness Month, and so we want to take this opportunity to share information with you all about this cancer and some of the topics our oncologists want you to be aware of. Joining me today is Dr. Robert Higgins. Dr. Higgins is a member of the Gynecologic Cancer Care Team here at your Georgia Cancer Center. He is also a professor in the Medical College of Georgia's Department of Obstetrics and Gynecology. Dr. Higgins, thank you for taking the time today to discuss cervical cancer with me, to share information with those watching and listening to today's episode.
Happy to be here.
So let's start with letting our listeners know a little bit about yourself. What made you decide to pursue a career in cancer care?
Well, I think a little background. I'm a gynecologic oncologist, and to do that kind of training, you first have to do a residency in obstetrics and gynecology. And so during those 4 years, I would assist in the care of women with cancer, and I was struck with how brave they were in dealing with these life-threatening diseases and sort of the resilience they had. And that just sort of inspired me and wanted me to take care of those women going forwards. So after residency, I did what's called a fellowship in gynecologic oncology.
Oh, that's wonderful. And I've been working in there ever since, in that field ever since.
That is correct.
When did you join our Georgia Cancer Center team?
18 months ago.
Okay. Well, we're glad that you're here. Have you had a good experience so far here with the team? And
yes, there's the cancer center here, the support staff, the nurses, everyone is very attentive to patients' needs, which is what we want.
Good, awesome. So our conversation today is about cervical cancer, but let's start with a discussion about the human papillomavirus, or HPV, and its connection to cervical cancer. What can you share with our viewers and those listening about that topic?
So human papillomavirus has been around for hundreds and hundreds of years, and it is transmitted sexually, and it's estimated by age 50 that 80% of Americans have been exposed to the HPV virus. And it is you have to be exposed generally to HPV to develop cervical precancerous lesions on the cervix or cervix cancer.
Okay.
So with that being the case, we fortunately now have a vaccine for HPV, and it's recommended that you start that sometime around age 11 or 12. And it can be given to people up to 45, but it's much more effective when you give it to someone before they begin having sexual activity.
And it's available to women and men, boys
Absolutely.
and girls.
I'm glad you mentioned that, Chris, because it's not just for women, it is for men, so males and females.
All right. So obviously cervical cancer is a female-only disease. How common is cervical cancer in our region of the United States?
Well, I think a little bit of perspective. In the early 1900s, cervix cancer was the second leading cancer killer of women in the United States. And now that rate has markedly decreased by over 70% in the last 100 years. And that's mostly due to the development of Pap Smears, which became sort of done starting in the 1950s. So that has made a significant difference in mortality rates from cervix cancer. As far as this region, I don't think our region is any different than other regions in the country. It is a little more, the death rates are a little bit more common in the black population than the Caucasian population, but those rates again are much less than they were 100 years ago.
Yeah, some of the research I reviewed said the number of women dying from cervical cancer is going down, while the number of women living longer after diagnosis is going up. I know that screening for cervical cancer has played a role in those trends. Talk to me a little bit more about the Pap smear and how important it can be in catching cervical cancer before it occurs and after it shows up.
So Pap smears, we recommend the women start that at age 21, and if they have a normal one at 21, then they repeat it every 3 years till 30.
Okay.
And then at age 30, they're to get it every 3 to 5 years. Along with what we call HPV testing. So by detecting precancerous cells on the cervix and that be treated with local therapy, That's why you're seeing such a decrease in the number of cases of cervix cancer, and hopefully even if you can diagnose it at an earlier stage if it was to develop into cancer.
Okay, so the Pap smears can help detect it before it becomes cancer, or after it becomes cancer, it can even help detect it earlier, which can increase the survival, the mortality rate for women.
Yes, I mean, like any cancer, if we catch it early, diagnose it early, we're much more successful in curing people than if it's at late stage disease.
Okay. Let's talk about risk factors for cervical cancer. What should women be aware of that could mean that they have some problems, some issues going on with their cervix that they should talk to their doctor about?
Well, the biggest risk factor, as we've spoken, is the exposure to the HPV virus. Smoking cigarettes does increase your risk. Those are probably the two main things. Most people almost all women with precancer of the cervix will have no symptoms, which is why getting your Pap smear done is important. If you have cervix cancer, the most common symptom is going to be abnormal bleeding from the vagina, sometimes pelvic pain, and sometimes a abnormal vaginal discharge.
Okay. All right. If a woman is diagnosed with cervical cancer, talk about the different treatment options that would be available to her.
So if women diagnosed with cervix cancer who have early stage, meaning stage 1, many of those will be candidates for what's called a radical hysterectomy, which are taking out the uterus and the cervix and lymph nodes. If it's more advanced, stage 2 through 4, then they're going to get a combination of radiation therapy combined with chemotherapy.
Okay. If those initial treatment options fail and don't attack the cancer like it's supposed to, or it works and the cancer comes back later on, what sort of new therapy options are currently being studied in clinical trials here at the Georgia Cancer Center?
Yeah, so for many years with recurrent cervix cancer, we treated them with a combination of standard chemotherapy. And what's evolved over the last few years is now immunotherapy has become actually approved by the FDA. So we've seen some very impressive response rates with this immunotherapy. So that we have clinical trials for that, and that's sort of the hot new way of treating recurrent cancer of the cervix. Obviously, we would hope we don't have to deal with that because hopefully we cure people the first time around.
And we can also catch it early if they're getting their Pap smears like they're supposed to on the schedule that you discussed.
Correct.
All right. Talk about the risk for women who may want to have treatment, or children after treatment. I know you mentioned a hysterectomy is possible. Talk about those risks.
So the vast majority of people are going to have problems with their cervix. It's going to be precancer. And so you can treat that locally and they can go on and have children. If they have cervix cancer and they have to require treatment, most of the time it's not going to be possible for them to have children going forward.
Okay. So what kind of advice, for those women that fall into that category, what sort of advice and information do you offer them, does your team offer them in terms of having children after treatment, maybe freezing eggs before the surgery happens? What sort of options are available?
Well, if they're going to have a surgery that's going to render them infertile, your only option really is to do stimulation of their eggs, have the eggs harvested from their ovaries, they're frozen, and then they can have, but again, it's still complicated because then you've got to find a surrogate to carry the egg after it's been fertilized.
Okay.
So that's not many women that actually can happen in. Unfortunately, we just don't have a lot of options to preserve their fertility if they have cervix cancer.
Okay. Well, Dr. Higgins, I appreciate you taking the time today to talk to me about cervical cancer and share this information with those watching, those listening. We appreciate all you do here at the Georgia Cancer Center, and have a wonderful rest of your day.
Okay, thanks very much, Chris.
Thank you.